Ladies and gentlemen, welcome back to my channel. This is your boy Professor OJ. Thank you so much for always coming back to watch my videos. If you're a first timer, don't forget to hit that subscribe button. If you're a return subscriber, thank you so much for coming back. Let me know what you think about our today's training or our today's health tutorial. And as usual, I'm going to share with you about male care package. Today I'm going to talk about the male care package. Okay, so we are going to talk about men. Okay, so this one is for men only. And you know, when we talk about men, we talk about prostate issues, not forgetting erectile dysfunction and also premature ejaculation, something that has really affected so many men outside here. So today I'm going to give a solution on how we can actually rectify issues concerning the manhood. Okay, and I get so many patients outside here, especially who are men who are suffering from the ED and the PE. So today I'm going to outline the causes and the possible solutions to all these problems. Okay, so as usual, we have to remind you about the 6 crucial important body organs. And number 1 is always the heart that operates with the blood and the blood vessels. Number 2 is the brain. Number 3 is the largest human organ, that is the liver. Number 4 is the kidney. Number 5 is your lungs. And number 6 is the pancreas. 3 causes of diseases. Number 1 is excess. Number 2 is deficiency. And number 3 is lack of knowledge. So whenever there is anything in excess in your body, it's always a poison. It's always supposed to be eliminated. And whenever there is a deficit of your body, then your body will have to show some signs. And because of lack of knowledge, that's why I'm organizing this tutorial so that you can get a better understanding of this. Now, welcome to Male Care Package Advanced by Greenwald International Business School. Now, let's get started. Our society puts too many labels to men, but gives them too little care. Basically, men care more about their cars rather than their own body. And that's why I find that when a man goes to the hospital, then hiyo shida imemfikia kwa kona. Okay, so men have their issues, but typically they don't get enough care about their issues, and they don't reach out very well because they have that fear. They are not like women who have monthly biological to respond. They don't get care for a lot of reasons, but today let's give them just a half of an hour to give them some basic care and concern. So men, that's why I said this one is for men only. Now, do you know what is the most misunderstood organ in male body? Most people don't know where is it. They don't know what it does. Even if somebody knows what it does, they don't know how it does it. And if they know how it does, if they don't know what can go wrong with it. Sorry, nimewachanganya. Okay. And this is the outline of what I want to talk about today. There are so many, but I want to measure on these 3. Number 1 is the prostate disorders, prostate enlargement, prostate cancer, prostatitis, and any other thing. Then you also have erectile dysfunction. So stay tuned because you are going to learn more. Then you also have premature ejaculation, also known as PE, not physical education, but premature ejaculation. Erectile dysfunction, also known as the ED, that is the ED. Now let's start with the prostate. Okay, now the prostate secretes a white fluid that nourishes and protects the sperm, and approximately you find that 30% of semen is made up of this fluid. Semen is that fluid that sperm swims on, and the fluid is alkaline, you need to know that, which protects the sperm within the acidic vagina. So the vagina of a woman is always acidic, and the semen or also the sperm is also alkaline. That's why when the pH of the vagina is changed from acidic to alkaline, and the sperm is also alkaline, then it is very dangerous very difficult for a woman to get pregnant, because that one will always have to kill or damage the sperms. Now, here is a sharing by a miserable wife. She said that all his life he slept like a stone, but now there is an annoying trip to the bathroom every night, and sometimes once or twice a night. Guess what? He complains to me about his numbness and weakness in legs, and sometimes I can read his pain from his face. Now, the most frustrating thing is he sort of tries to avoid me in bed. This is a lady narrating his story. It's a story I'm telling you that a lady is narrating. And he used to hunger for me, but now he even doesn't want to touch me because the feelings are normal. And all the signs give me one hint that her husband has some problems with his prostate and needs a thorough checkup. After seeing the doctor, he was diagnosed with what is called prostate cancer. Now, no one knows exactly what causes prostate cancer, but risk factors associated with include the prostate gland serves as a fertility function as it secretes the seminal fluid that helps in nourish and transport the sperm that comes from the testes. So, epidemiology, prostate cancer is the second most frequently diagnosed cancer, the second most after cervical and breast cancer. Then the sixth leading cause of cancer death in males worldwide is the prostate cancer. And among black men, you find that sorry, you find that 99 among black men, 19%, nearly 1 in 5 will be diagnosed with prostate cancer, and 5 of those will die from this disease. So a man is 35% more likely to be diagnosed with prostate cancer than a woman with breast cancer. So this one is actually a very deadly disease called the prostate cancer. Okay, so we need to prevent it with all means. Okay, now, do you have risk of prostate cancer? Are you older than 50? Do you have a father, brother, or son who was diagnosed of prostate cancer before they were 65? Do you eat a lot of red meat or high fat dairy products? Are you overweight? Then, if you are having these problems above, then just know that you are at high risk of getting what is called the prostate cancer. But to prevent this, you need to do the following. Number one, eat a low fat diet. Make sure that you are eating foods that have low fat. Number two, make sure that you eat fish, because fish has what is called a deep sea omega-3 that is good for anti-inflammatory. Okay, then eat more fruits and vegetables so that you can get the required nutrients for your normal prostate function. Then maintain a healthy body weight, 55 to 75 standard weight. Exercise regularly. Doing exercise, my friends, is something which is very much important. And last but not least, don't forget as a man to always have what is called regular sex. Yes, I know you understand it. Always don't forget to always have what is called have a regular, at least 3 to 4, having regular sex 3 to 4 times in a week is good for prostate in a man. Okay, good. Now, the next thing is what is called prostatitis and enlarged prostate. Now, when you visit us, we will have to conduct what is called a computerized screening to check the prostate using our high-tech machines. And in case there is any problem, then we will have to recommend medication that will help you to make sure that your prostate operates normally. Now, prostatitis or enlarged prostate, you can see that prostatitis, these are normal prostate. These are normal prostate with the urethra here. You see the urethra is very much open. So when you go for a short call, the urine will pass on frequently and pass on well. Now, when you have inflamed prostate, that means it will thicken the walls of the urethra. There's a good picture down here. These are normal prostate. Normal prostate, normal urethra, very much open. Now, this one is enlarged prostate, compressed urethra. You see the urethra is compressed. So hii ndio inaletaga ile dalili ya mtu anakojoa lakini mkojo haitoki yote, ana feel ni kama bado imebaki. Okay, hiyo ndio inaitwa prostatitis or enlarged prostate. Okay, now prostatitis, unlike most prostate problems, prostatitis is a very tactical kind of terminology. There is inflammation or an infection of the prostate. So when you visit us for a checkup, we will see it and we'll see whether there is an UTI or RTI, reproductive tract infection or urinary tract infection. And it occurs often in young and middle-aged men. Only 5% to 10% of men develop what is called prostatitis in their lifestyle. So when you have that, you'll be having what is called the BPH, benign prostatic hyperplasia. So everything here is always checked using our machine. So you always have frequent urination, utakuwa unakuwa na haja ndogo ya mara kwa mara. Urination at night, especially at night, you go for frequent urination. Urgency to urinate, utakuwa unasikia kukojoa kila wakati. Then difficulty in getting urination, sometimes you go to urinate and then you take like few seconds before the urine comes. And you also have weak urine stream, okay? Umeenda kukojoa lakini mkojo haifiki mbali. I think there is an activity we used to do when we were young for men. Tulikuwa tunashindana ni nani mkojo yake inafika mbali. Now when that one used to happen because we had a normal prostate and normal urethra, especially for children. Then you also have dribbling at the edge of urination. Unamaliza kukojoa lakini ukishake after use unapata tone zinakuwa kwa trouser. Inability to completely empty your urinary bladder, and also urinary tract infection, also called UTI, or you also be having what is called RTI. Okay, now is there a solution to this? Yes, with Greenwald supplements, we have the products that can help in prostate disorders, be it prostatitis syndrome, be it prostate cancer, be it prostate enlargement, or any other prostate condition. Then these are the products that you can use. Number one is the ProstaCare capsule, also called ProstaSure. ProstaCare to take good care of your prostate. ProstaSure to make sure that your prostate is sure. So it's just one product with the same name, okay? Now this one will help to prevent prostate disorders, and it also relieves the signs and symptoms of prostate enlargement. These signs that we've seen here, because there is a difference between a disease and a symptom of the disease. That is something I always tell people. A disease mostly attacks a body organ. Now the body organ attacked here is the prostate. When the prostate is attacked, it will emit some signs and symptoms. So the frequent urination, the urination at night, the urgency to urinate, difficulty, and the UTI, those are signs and symptoms of that condition, okay? So make sure that you understand to know that. So the ProstaCare will make sure that it relieves the signs and symptoms of the prostate enlargement, and it can also improve blood circulation and restrain growth of pathogenic microorganisms in the inflamed prostate, because prostatitis in inflammation or infection of the prostate, okay? Then we also have Lysopene soft gel, okay, also called B-carotene for men. Only 3 products good for that. Note them down, because when you have a patient who are having prostate issues, then you can always recommend this medication. Now, recommending this medication, you see there are 3, but personally, I always like treating patient based on duration, not on medication. It is always important to treat a patient based on duration, not on medication. Meaning, maybe you have this patient with prostate cancer or prostate enlargement or prostatitis syndrome, and you recommend these 3 medications. And he has been suffering with this condition for over 1 year, okay? Maybe these products can only take 1 month. So what if you tell this patient that I will recommend you use these 3 medications, but use them for a period of 6 months? That means when one medicine is over, you need to rebuy it, meaning you retake it again, okay, for a period of 6 months. So treating on duration is better than treating on medication. Lysopene or B-carotene, lysopene as a powerful antioxidant will slow down the progression of prostate enlargement, and it will improve what is called the signs and symptoms of such condition. Then deep sea fish oil or omega-3 products have strong anti-inflammatory properties, and it can improve the inflammation of the prostate. So these are the 3 best products that can be used to make sure that it protect and take good care of our prostate. So ladies and gentlemen, I think you have noted something down. Now let's get to the second segment. We call it the ED, erectile dysfunction, also called impotence. You can also call it impotence, by the way, okay? Impotency. Now, what is ED? ED is the inability of a man to get and keep a sustainable erection firm enough for sexual intercourse. And you find that 1 out of 5 men aged above 40 will have to suffer from the erectile dysfunction. And first, I have a tip for women. So women who are listening this video for the first time, I have a tip for you. Now, stop any bad habits that could lead to ED. For instance, quit smoking, cut drinking, and lose weight. That is a tip for women. Make sure that you talk to your partners too, always. quit smoking, cut drinking, and lose weight. Quit smoking, living, you need to leave it at all cost. Cut drinking, make sure that you take it in a minimal, okay? And always lose weight. Then that is first thing. Secondly, another second advice. It is important to accompany your partner to have a checkup in the hospital. Though most men always don't want their women to accompany them. Okay, when they're taken to the hospital, make sure they check their blood pressure, make sure they check their blood sugar and also lipid levels. If important, they can always take some checkups like the ECG, also called electrocardiograph, to rule out the possibilities of the erectile dysfunction, and it is usually a sign of underlying health condition that needs treatment. So since erection is all about blood flow to the penis, any disease leading to deficient blood flow may cause weak erection. So if we successfully identify the physical problems, we can address the underlying causes right at the source to help your partner restore their confidence at bedroom. Hypertension regulates blood pressure, diabetes, also regulate blood sugar, that is hyperlipidemia, regulate blood lipid levels. Okay, so by doing so, everything will be okay. Because I want to give you a tip for a man to have an erection. 3 organs involved. Number one is the heart, is the brain. So the brain will send some through neurotransmission information. It will send some impulses to your heart, and it will tell your heart to pump more blood into the penile muscle, also called the penis. But the heart pumps blood all over the body. That's where we now indulge the kidney. Now the kidney has something called adrenal gland that secrete hormones. Now these hormones will control the information from the brain to tell the heart that more blood should be pumped into the penis for a man to have erection. So that's why if a man is having some brain issues like emotional instability, anxiety, stress, then erection might be affected. Number two, if a man is having heart-related problems, especially the blood and the blood vessels, okay, then you have an erection. Number three, if you know any man who is having kidney issues like kidney dialysis or kidney stones, no erection at all, because these 3 organs are very much important. Now, if you come to us, we'll have to analyze what is called a comprehensive screening to your brain, to your heart, and also to your kidney to check the root cause of your ED and also recommend right medication for you to have a permanent solution. Okay, because ED can be caused by heart-related problems such as high blood pressure, as you can see, diabetes, so you also need to regulate that. Too much intake of medications is also very dangerous for men, and also nerve disorders, hormonal problems like low testosterone hormones, smoking and drinking, and also certain types of prostate and bladder surgery. So those are the things that mostly affect men outside here, and you find that they also have problems. Okay. Now we need to look for a solution to this. Okay, is it psychological erectile dysfunction? Now, all psychological erectile dysfunction is about our brain. That is one thing you need to know. And up to 20% of men face the problem of psychological impotence and performance anxiety, worry about age, and body image issues. Okay. Now, when you talk about body image issues, you find that those men who are obese are at high risk of making sure of mostly being affected by this condition. Okay. Yeah. Now let me try to express this. Oh my goodness. Let me try to express it in detail. Okay. Now, women aren't they only ones concerned about how they look naked. Men can be shy about their bodies. It could be due to the weight they have put on their sagging or muscles that comes with age. So in any case, a poor body image can lead to poor sexual health. So while getting your body into better shape can boost your self-esteem, know that healthy relationships thrive on intimacy and communication and not good looks. Eh, So kuwa kwa ndoa, kwa relationship, hakikisha kwamba mambo ya kitanda pia unakuwa sawa. Ukikuwa kama la sivyo, utagongewa my friend. Okay? Utagongewa. Now, worry about age, because many men fear that as they get older, they will lose the interest in sex or their partner, or even worse, that their partner may lose interest in them. Don't worry about that, because with men, we don't have a menopause. We only have a menostop when we die. Performance anxiety, okay? Experts say that one of the most common times for ED to occur among younger men is when their desire to please their partners becomes more overwhelming. Unataka kuprove ya kwamba uko sawa. So this one can always cause them not to perform well at all. And especially they watakuwa wanakuwa nile tunaita premature ejaculation, okay? Masturbation is something that has really affected so many people. One day I put an advert in Facebook about effects of masturbation, and I realized that, damn, so many things really happen outside here, and we actually need to do something about it. Well, that one will be a topic for another day, okay? Now, let's get to another thing here called the PE, also called premature ejaculation. Premature ejaculation, okay? Now, premature ejaculation is when a man releases before the required time, okay? So that is another common issue that is affecting so many men, popularly known as PE or premature ejaculation. Like I've said, it occurs when a man ejaculates sooner during sexual intercourse than his partner would like. Unamwaga kama mwanamke wako hajafika. So actually there is a no fixed time frame for premature ejaculation, because premature ejaculation, also known as rapid ejaculation, is the most common type of sexual dysfunction in men younger than 40 years. Mostly is affecting men younger than 40 years. And an estimated 30% of males experience this problem. Now, in most cases, you find that premature ejaculation does matter because it makes people unhappy and frustrated. Yeah, inakufanya unakuwa frustrated because umeenda pale na cycle kidogo kidogo, mambo imekuwa mbaya, okay? And in severe cases, P can threaten or even ruin a marriage. And by the way, in severe cases, if you are a 1 minute, 2 second man, or 1 minute man, as people say it, simply because it spoils the sex lives of both partners. Now, sometimes the condition is so bad that the man can't have sex because he ejaculates before he can get into the vagina. That is very dangerous, very dangerous. So this can be devastating for a man's self-confidence. Wewe hata kama unainua gym, kifua imefura, watu wanakuogopa huko nje, ni security wa fulani. Lakini huko chini mambo ni mbaya. Bibi anakuona kama trouser bure, naita long lilo, okay? Mwanaume suruali ama mwanaume suruali. And it can be hugely frustrating and annoying for his partner, especially if she wants to get pregnant. It's very dangerous. So make sure that we need to take good care of this, because la sivyo utagongewa, my friend. Now, the most common type of sexual dysfunction in men younger than 40 years, and an estimated 30% of men experience this condition because of 1, overproduction of sex hormones, 2, not having sex often. Remember, we said it is important for a man to have at least 3 to 4 days of having sex in his life. Then too much intake of drugs, masturbation habits, something that has really affected so many people. Then physical factors may cause premature ejaculation, and also physical illness when a man is sick. So these are the factors that can cause what is called premature ejaculation. Now, check whether it is physical problem. So you need to assess nerve function, then also check hormone status. So when you visit us, we also have to check the nervous system, whether there is transmission information properly, so whenever your brain is okay. So make sure that there is blood flow is measured by assessing pulse and penile blood pressure, making sure that enough blood is being supplied to the penile muscle or penis. Then also hormone status, checking gonadotropin and testosterone hormone, that is prostate examination. And by doing so, we will be moving ahead, okay? Otherwise, these are the products that we recommend for a man who is having erectile dysfunction and also premature ejaculation. Permanent, remember I've said don't treat on medication, treat on duration for a period of 6 months. Personally, I like treating for 6 months so that this patient can have a permanent health, health. So if you are treated by me and you take medication less than 6 months, then don't complain because you didn't complete your dose. It is important for you to complete your dose after 6 months. Vic Power Capsule. Vic Power Capsule will improve quality of sexual intercourse. It will relax the muscles around the penis while enabling blood flow into the penis. So this one helps a man to achieve what is called a sustainable and a strong erection. So it is one of the best products that we recommend for men who are having no underlying issues like blood pressure or hypertension. Don't give big power to somebody who's having diabetes because of erectile dysfunction due to diabetes. Don't recommend that one. Kidney care, remember I said for a man to have erection is the brain, is the heart, and also the kidney. So we also recommend kidney tonifying capsule that boosts the kidney channel that governs male reproductive system. It will invigorate the kidney to preserve essence energy of the body, improve vitality, and also masculinity. Ginseng RFH capsule that boosts sexual drive, improves erection, and increases sperm count and motility. So it is also good to increase the sperm count and also motility, the ability of the sperm to move from the vagina all the way to fallopian tube so that it can fertilize easily. Ginkgo biloba improves the overall blood circulation and that of the penis. It makes sure that the penis is receiving sufficient supply of oxygenated blood. Then zinc tablet. So zinc presenting in semen helps sperm against bacteria and free radicals. It is needed to make the outer layer and the tail of the sperm and also influences the number and healthfulness of the sperm. Zinc deficiency of men mostly leads to what is called sperm motility. Also, sperm motility. So it is always important. So these 5 medications can be recommended to men who are having erectile dysfunction and premature ejaculation. Remember, they help in erectile dysfunction, premature ejaculation, and also help in the beneficial of the sperm so that your sperm can also become healthy and of good health. Psychologically, we must change our mind. So men shouldn't expose certain feelings. So it is not important for us always express certain feelings because that one can affect your manhood. Number 2, sex is a performance. So it is always important for you to perform, not a show off. Okay, it is a performance. Performance has some tactics and strategies and stages. A man must orchestrate sex all the time. Then a man always wants and is always ready to have sex. So I was listening to Miles Monroe and he was telling me that number 1 need for a man is sex. Number 1 need, not want. Number 1 need for a man is sex. Okay? Number 1 need for a man is sex. And number 1 need for a woman is not sex but is affection. So if you give your woman affection, you will get what you want. I think you have noted something there. Number 1 need for a man is sex. Number 1 need for a woman is affection. So a man always wants and is always ready to have sex. They have what is called extrovert feeling. Okay, all physical contact must lead to sex. Sex equals intercourse, and sex requires an erection. And good sex is increasing excitement, terminated only by orgasm, and sex should be natural and spontaneous. So, ladies and gentlemen, I hope you have learned something. I want to end it there. So, in case you have any questions, in case you've written those medications down and you'll want some deliveries or prescriptions or any inquiries, then don't forget to drop a comment. And also, you can get in touch with me in my inbox or through my social media platforms. And by doing that, we will be helping you to become a proper and a normal man. Otherwise, thank you so much. Don't forget to drop a comment concerning what you have learned in this video. And if you haven't subscribed, don't forget to hit that subscribe button. Turn on the notification. As you can see, these trainings are very nice. Turn on the notification so that whenever I drop a new jam, you are always there to get a feedback. Okay, for inquiries, consultations, and bookings, make sure that you get in touch with me or with the person who we shared with you this tutorial. This tutorial can always be downloaded and they can always be listened by people who need to know more about men's health or any other health issues. So all my health tutorials are always free. They can be downloaded because they have no contact. Maybe you can be listening to this video and you see that you can download it and give it to your team so that they can listen it. You are free to download it because it doesn't have any contact. Okay, so always feel free to do the same. Otherwise, I hope you are always learning. Stay tuned because I'm still doing a lot of research to make sure that I present to you the most important conditions that are affecting people outside here. Otherwise, thank you so much. I wish you all the best as you listen to this and as you come to the end of this. And don't forget to drop a comment. Okay, also you can follow me in other social media platforms. Thank you so much. See you in my next video.